Public health is in crisis. Longtime CDC staff are leaving. States like Florida are rolling back vaccine requirements, and federal funding cuts are gutting jobs and programs. So, is public health cooked? Let's talk about it. Hey everyone, Omari here, founder and CEO of the Public Health Millennial, where we help public health people learn, navigate, and transform their public health journey. Be sure to hit that subscribe button, that like button, and tap into our free community below. CDC is in turmoil. When people who've been at the CDC for decades, through red and blue administrations, say that they can't put their name on documents, that they can't put their name on guidelines, that's not drama. That's a breakdown in trust for the very guidelines that the agency puts out to protect the public's health. This is a very disheartening moment in public health, and it raises a lot of concerns particularly around data integrity. What is data going to look like coming out from the CDC from now on? Is it going to be the actual data? Are they actually going to collect data equitably? And are we going to have data equity? These two things are big questions right now. And when we think about the reason that many of these staff left, it was the guidelines reliability, changing the vaccine guidelines. And they couldn't stamp their names on this and they had to leave. And how do we, as a public health broad workforce, work together when one of the largest agencies in public health isn't sharing truthful information, isn't collecting information that is really going to move forward the issues that you and I know are so important in public health and in improving communities' health? When you look at the example of Susan Monarez ousted as a leadership for the CDC is in turmoil. I don't know where this puts us right now, but there are a lot of questions that are going to be asked. And we as public health persons need to step up in this moment and try to clear up any of the mist for our community folks and explain where they can go for reliable information. Because right now things are getting very sticky and we need to continue to just be a part of those conversations to share real public health data, real science backed data. Policy rollbacks in Florida. This is a huge step backwards, undoing decades of progress in protecting kids from diseases like measles, polio, and other preventable diseases, many of them that we don't even think about. But now, with the CDC not tracking diseases, do we even know if measles is an epidemic? Do we know what is happening with the different infectious diseases that are going around? And are we going to be able to have the resources and a focus to track these resources? I don't know. But Florida ending school vaccine mandates is very troubling. This doesn't just affect Florida, it affects many other states, as other states might follow this lead, this lead that takes us backwards, this lead that puts children and adults in danger, and this lead that puts the most vulnerable people once again more likely to be disadvantaged by these changes. This is going to lead to outbreaks of diseases that were once under control, diseases that we didn't have to think about. And this is very concerning, especially if you are a parent with young children or you have people that are immunocompromised in your family or in your friend group. Vaccines save lives. They prevent illnesses. They protect communities. We need to continue to do our work to share this message and to break it down as simply as possible so that everyone understands why we need vaccines. The job market collapse. I've spoken about this time and time again. Everyone is telling people to build a career in public health, and now the jobs are evaporating overnight. It's not only demoralizing, it's dangerous. But I would say, even as the federal funds dry up at the Health and Human Services, at the CDC, when federal match grant dollars are not coming down, when public health, thousands of public health jobs are tied to grants that are not going to be refunded. It's a challenging time for many people who stepped into this field to do great work. And I tell you once again that even though this might be a challenging time for you, the skill set, the perspective, the lens that you have with your public health degree or your public health experience is so invaluable. And it can be used and transferred into so many aspects of society. And especially with these changes that we're seeing now, there's going to be a greater need for public health in the future. So just remember that. While it might feel challenging right now, you are needed now and in the future. Safety net cuts. Medicaid is under attack with $1 trillion of Medicaid up in the air. 12 plus million Americans may not have health insurance because of these changes. This is very concerning. And while this is touted as a way to save money, we know that primary prevention, public health, is so important to ensuring that communities are safe and there's an economic output. There is a benefit to investing in public health. There's a benefit to society when everyone has health insurance. And yet we're taking steps to move backwards from this. When we see SNAP reduction for millions of families across the US, this is concerning. These cuts are going to worsen health inequities. They're going to cause families a lot of distress in an economy that is even more challenging. Public health isn't just vaccines. It's the policies that keep people fed and cared for. Cut those, and you're creating crises that hospitals cannot solve and are expensive. So, is it cooked? Yes, the system is under immense strain right now. It feels so hard to be in public health, whether you're a professional or a student. But public health has always been about resilience and reinvention. When public health was created in the industrial age, do you think it was easy? No, it was not. Those challenges have just evolved into new challenges. But every challenge creates an opportunity for us, opportunities for new leadership, for new ways of visioning grassroots organizing, new ways of rebuilding trust and telling our public health story, something that we need to continue to do. Public health might feel cooked right now, but it's on us, professionals, students, communities, to build the public health that we need, to show up and share why we need public health, why it is so essential and a vital part of our society and for the health of our communities. We play a part in this. What do you think? Is public health cooked? Or is this just a painful reset? Drop your thoughts in the comments below. And if you care about where public health goes next, hit subscribe. Talk to you all later. Take time for yourself this week. Peace.